let's start at the top, and we're going to do a little bit of a free-for-all here, unless anyone wants to take it. The first question here, certainly if you're allowing parents into the center, then that's probably going to qualify as a frequent visitor, right? As the current protocols dictate, parents are not coming into most childcare centers, and so you don't necessarily need that at this point. But if you are going to allow them in, and if protocols allow that, then I would say yes. If they're a frequent visitor, then they would need to comply with your policy.
And I would add to that, Kelsey, that we have to remember that our human rights obligations apply not only in the employment context, but also as a service provider. So whenever we're providing a service to someone, we have those exact same kinds of obligations. So probably the answer to this, where possible and practical, if you could maintain contact with parents outside as opposed to coming inside, depending on what your operation is like, that would probably be the easiest thing, because you can get into a whole other host of issues if you have parents constantly coming in, because I think that Kelsey's right. I think the policy probably does apply to them as a frequent visitor as well.
On the next one, certainly, and I'm of two minds with respect to referencing the TDSB policy in your own policy. I think as an employer and as an organization, you want your policy to stand alone, and you want to back it up with your actions. Obviously, if you are in a TDSB building, you have to be cognizant of those obligations. But given the statement on the TDSB's website about what the procedure will cover, I'm confident with the policies that we've worked on thus far for some childcare centers who are located in TDSB facilities. We will certainly meet, if not exceed, whatever the TDSB comes up with. However, you do want to make provision in the policy for amendments or change as necessary, and typically that's something we include in any policy. And certainly, I kind of glossed over the elements of the policy, but that is something that we would include in a vaccination policy, is that it's subject to any additional requirements or changes dictated by our regulators, authorities, or tenant or landlords, if that be the case.
And just to add on to that, given how much we've seen the discussion shift on vaccination policies in the past couple months, and as with everything related to COVID, the amount of fluctuation we've seen, the amount of change as we get more information and things evolve, I think all your policies and procedures should have, a little one-off sentence at the end acknowledging that, as Charles said, and as we're all sick of hearing, things are unprecedented. We're developing as more information and more guidance becomes available. And with that, it's only responsible that the center is keeping up to date with various changes and updating policies accordingly.
Yeah, and then just to loop back, I think Karen's added on a second part to the first question where she says, can we state that in the event of an outbreak or case of a vaccine preventable disease, staff who are not immunized may be excluded from the childcare center? This is to minimize the risk of spreading disease and will be unpaid if sick time has been exhausted. So obviously I'll give Kelsey and Christina a chance to weigh in after this if they want to, but I think the answer to that is yes, that things change in the case of an outbreak. And when we are developing our policies, we always include clauses that state, this is all context dependent. Employers reserve the right to place employees on paid leave of absences. You could stipulate in the case of an outbreak or not. There may be other reasons why that might be necessary too. So absolutely, I don't think it would be a problem to include something like that, either covered under a general sense or even a specific clause in a policy that would cover that kind of situation.
Yeah, I would agree. And, for licensees, there are requirements. I'm blanking on the exact infectious disease that tends to be covered. But in the childcare setting, certainly there is precedent for, if there's an outbreak of an infectious disease, if someone is not immunized against that, then they can be excluded from the workplace. That's, I believe, legislated in I'm sure it's somewhere. I'm blanking on the legislation. Kelsey might be able to jump in and assist, but certainly there is precedent for that, and I think it is good sense.
What are you thinking of the CCEYA, Christina?
That's exactly it. Thanks, Kelsey.
And I'm not sure if or what is in there, but it wouldn't surprise me. But certainly from a legal principle perspective, I agree with Charles. Absolutely. Someone can be excluded in the event of an outbreak because that's not going to be safe for them. Arguably, you've got that responsibility under the Occupational Health and Safety Act to provide a health and safety or a healthy and safe workplace, and therefore that would and protect each and every employee, whether whether they're vaccinated or not. So certainly that's fine. So not hiring people who aren't vaccinated, so new hires. Again, if you're taking the more robust approach, we certainly have have seen employers say, we're not going to hire anybody who's not vaccinated, and that's just the way it is. These kinds of things already exist, right? People need their TB tests. People need to be vaccinated against, the MMR suite of vaccines. All those things already exist, right? And so, in that sense, there's certainly a precedent for it. And, in our view, again, because of the shift in the outlook on vaccination and what we can do from a mandatory perspective, I think you can say, hey, we're not going to hire you. Again, subject to the need to accommodate under the Human Rights Code. How long will it need to be in place? That's something that needs to be mentioned in your policy as well. And certainly, I think it's just reviewing from time to time. And, you want to be flexible there, and you essentially just say it'll be revisited as necessary based on guidance from public health authorities. That kind of a statement, I think, is enough. I can tell you from, anecdotally, we've had at least one client where the union has pushed back saying, I think this is appropriate for now, but it's not forever. And that's where we said, well, we've addressed that in the policy in terms of saying we'll take our guidance, and that was enough for the union to say, okay, that's okay. I see a couple of other questions have popped up as well. So we just talked about Teresa's asked about whether that would be discrimination if we're talking about not hiring somebody who's not vaccinated. And again, that's what I was getting at in terms of you still have to make sure that you're obeying your duty to accommodate under the Human Rights Code, but otherwise, if they don't have a valid reason, then it's not, it's not unlawful discrimination. An employee is pregnant, refusing to get the vaccine. Is this considered medical or personal? Well, until she provides a medical note from a doctor saying, I've advised her not to do this, it's personal, right? This is, I think that if I recall correctly, pregnant women were in some of the earlier priorities for vaccination. So, I'm not sure how many doctors out there would be saying don't get it, but, in any event, if the person is saying that's the reason, then they need a doctor's note. I'm going to jump up. Kathy included a question in the Q&A. One center I work with is located in a church. There are church staff who share office space and equipment. would we be required to apply these requirements? And there's public use and so on. That is a very interesting and kind of complex, layered question with respect to shared spaces. And that's, if you look at how the TDSB policy could affect childcare, it's almost the same thing, except not mandated necessarily by any authority. I think that would be something certainly to discuss with the church about what they have in place and what they're not willing to do. And based on what, as Karen mentioned earlier on, the Ministry of Education is intending to come out with something to help licensees in developing their policies. And, I think you may have specific obligations with respect to those other staff members and visitors that would force that on them. And then I don't know where that leaves you, Kathy, with respect to a debate or, discussion with church and church staff, but that you may not have a choice. Okay, is the employer, who's responsible for providing the rapid test? Well, it's not the employer's responsibility. Some employers, for instance, one organization that I work with outside the childcare sector was kind of grouping together with a number of sister organizations in order to establish a rapid testing program. And this is before any of these announcements came out, as a means to try and keep staff coming to work and so on. But there's no obligation on you to do that. In our view, it's simple. If your policy is going to allow for testing, there's no obligation on the employer to make that available or pay for it. In our view, if this is an alternative that the employee is choosing, I'm talking about if you're making that available for non-accommodation purposes. If it is an accommodation, I still don't think it is a responsibility, because you are not responsible for the cost of anything else. Whether you want to make some kind of specific provision is up to you, but I don't think there's an absolute legal cost or legal responsibility. If we're talking about accommodations, then maybe that's a conversation we need to have separately to kind of sort through it. And I don't think you have to accommodate time off to get the test either. You need to set up, if testing is going to be required, you need to determine what your thresholds are, what's appropriate, take some guidance from other sectors and so on. And then another question about rapid testing: can staff members do it on themselves? I'm not an expert with respect to how the rapid testing works. I know when the province was making it available to small businesses, they had specific requirements, and the reason for that was because it's all part of reporting, right? And I think Christina mentioned, or it might have been Charles earlier on, that there are reporting requirements for testing, and that's probably why they're saying trained professionals have to do it. And this, I know this was Karen's question: would we be willing to provide a policy template for childcare to use for a fee? Of course, we're willing to work with anyone and everyone. I'm not sure exactly what you're getting at, Karen. Happy to chat with you offline, but because the problem with providing a template and just releasing it out into the wild, so to speak, is that our legal responsibility and our legal liability goes with any advice or product we give. And so without knowing where it might be going or what's happening to it after it leaves our hands, the potential for exposure for not only an organization who might, use it improperly or use it without our specific guidance, but also for ourselves and with respect to our regulators, is up there. That doesn't mean we're opposed to it, but I just need to know, where it's going and who's going to avail themselves of it. And then we can talk about, whether there are economies of scale to be had. Danielle, I think there were a couple more. Is there another slide?
These were all the questions.
Oh.
We did though just, does anybody know how often the test is required?
So that's really a matter of, taking public health guidance. One policy that we've seen in the childcare sector dictated twice a week, being provided twice a week. So this also then has to go on employees to organize themselves to get it in time, right? Because they're not getting their results necessarily right away. If they're getting the full test, if they're doing rapid antigen screening, then obviously it's a much quicker turnaround. So these are all things that need to be contemplated when you're developing your policy.
This is the truly frustrating part, because you could even see differences between childcare centers and what might be reasonable at one where there's very few cases or relatively low enrollment might be different from a large childcare center where, it's in a red zone and there's cases all over the place in the neighborhood. So it really is frustrating to try and nail that down. And at the end of the day, I think you just have to, like we've been saying, look at public health guidelines, look at the context of your specific center, and just make the best, most informed decision that you can in terms of frequency.
Kelsey, it looks like you're giving us some good information, but you're on mute.
Thank you, Christina. It wasn't even good information. I was just thanking everybody because it looks like almost everybody was able to stick with us for the Q&A portion. And, again, feel free to share this with your colleagues out there in the sector. Let them know how to access this presentation, which we will do our best to get up as quickly as possible on our website. And we appreciate how easy it is to work with everybody in this sector. That's just kind of going back to what Karen has said in the Q&A there. Thank you for supporting the childcare field. Well, I think I can speak for all my colleagues and say that dealing with our childcare clients is some of the easier times. Not to say that the problems aren't easy, but by and large, our clients in the childcare sector are some of our easiest and friendliest to deal with. So we appreciate that. Right back at you, I guess would be the way to say that.
Just before we wrap up too, Kelsey, we just had one more question about whether all employees should be tested, considering how easy it is to spread the virus.
So certainly something that has been contemplated, and I think that would go more towards, you can put that in your policy if you'd like. I think where that comes in is maybe, again, like Charles said, context specific. So, if there's an outbreak, then everybody's doing it. Or if case counts rise in general and continue to rise, then maybe that makes more sense. And we're saying, because we know the Delta variant especially is, more transmissible even among the vaccinated, right? So is it absolutely necessary right now? That's on you to decide with respect to your risk factors and your tolerance for risk. Is it something that you can build in some flexibility toward? Absolutely. That's kind of how I would look at it right now, I guess.
And then one closing thought from me on that point, just a reminder that vaccination policies and the vaccination mandates is part of the COVID-19 prevention policy for our childcare centers. It's not the entire prevention strategy. So for a year and a half now, you've been putting good policies and procedures in place around infection prevention, whether that's increased sanitation, mask wearing, testing as needed. So keep up all of those protocols and policies. The vaccination policy works with those. It doesn't replace them.
Okay. Thanks again, everyone. And we hope that we're able to do a non-COVID-19 webinar sometime in the not too distant future. And in the meantime, we will continue to bring you updates as we learn and figure them out ourselves. And as we all weather the storm, we wish everyone, safe and happy days ahead. Thanks. And thanks to Christina, Charles, and Danielle, of course, as well.